Hello everyone, welcome back to Oncology. This is episode 12, Immune System and Cancer. So this is today's outline, what the immune system does. Cancer and treatments may weaken immunity. The immune system can help to fight cancer. Inbuilt immune protection, neutrophils, acquired immunity, B and T cells, and cancer treatments that use the immune system. So let's start. What the immune system does. So, the immune system protects the body against illness and infection caused by bacteria, virus, fungi, and parasites. It is a collection of reactions and responses that the body makes to damage cells or infection. So, it is sometimes called the immune response. The immune system is important to cancer patients in many ways because cancer can weaken the immune system. Cancer treatments may weaken the immune system. The immune system may help to fight cancer. Cancer treatments may weaken immunity. Cancer can weaken the immune system by spreading into bone and marrow. The bone marrow makes blood cells that help fight infection. This happens most often in leukemia or lymphoma, but it can happen with other cancers too. The cancer can stop the bone marrow from making so many blood cells. Certain cancer treatments can temporarily weaken the immune system. This is because they can cause a drop in the number of white blood cells made in the bone marrow. Cancer treatments that are more likely to weaken the immune system are chemotherapy, targeted cancer drugs, radiotherapy, and high dose of steroids. The immune system can help fight cancer. So some cells of the immune system can recognize cancer cells as abnormal and kill them. Unfortunately, this may not be enough to get rid of a cancer altogether. But some new treatments aim to use the immune system to fight cancer. So there are two main parts of the immune system, the protection we have from birth, inbuilt immune protection, and the protection we develop after having certain diseases, acquired immunity. So let's discuss these two protections. So first is inbuilt immune protection. This is also called innate immunity. These mechanisms are always ready and prepared to defend the body from infection. They can act immediately or very quickly. This inbuilt protection comes from a barrier formed by the skin around the body, the inner linings of the gut and lungs, which produce mucus and trap invading bacteria. Hairs that move the mucus and trapped bacteria out of lungs, stomach acid which kills bacteria, helpful bacteria growing in the bowel which prevent other bacteria from taking over, urine flow which flushes bacteria out of the bladder and urethra, white blood cells called neutrophils which can find and kill bacteria. Different things can overcome and damage these natural protection mechanisms. For example, something may break the skin barrier, such as having a drip in your arm or a wound from surgery. A catheter into your bladder can become a route for bacteria to get inside the bladder and cause infection. Anti-acid medicines for heartburn may neutralize the stomach acid that kills bacteria. So certain cancer treatments can also overcome these protection mechanisms. Chemotherapy can temporarily reduce the number of neutrophils in the body, making it harder for you to fight infections. So radiotherapy to the lung can damage the hairs and mucus producing cells that help remove bacteria. Okay, neutrophils. So these white blood cells are very important for fighting infection. They can move to areas of infection in the body. They stick to the invading bacteria, viruses or fungi, and they swallow up the bacteria, viruses or fungi and kill them with chemicals. Your normal neutrophil count is between 2000 and 7500 per cubic millimeter of blood. When you don't have enough neutrophils in your blood, doctors may say that you are neutropenic. Chemotherapy, targeted cancer drugs, and some radiotherapy treatments can lower the neutrophil count, so you may be more likely to get bacterial or fungal infections after these treatments. So it is important for you to know the following when having cancer treatment. Infections can become serious very quickly in people with low neutrophil counts. Antibiotics could save your life, so if you get a fever or feel ill, phone your cancer center or go to hospital straight away. You may need to take antibiotics to help prevent severe infection if your blood counts are low. You are more likely to become ill from bugs you carry around with you than from catching someone else's. This means that you usually don't have to avoid contact with your family, friends, or children after treatment. You can ask your doctor or nurse what precautions you should take against infection. Now let's talk about acquired immunity. So this is immune protection that the body learns after having certain diseases. The body learns to recognize each different kind of bacteria, fungus or virus it meets for the first time. So the next time the same bug invades the body, the immune system is ready for it and able to fight it off more easily. This is why you usually only get some infectious diseases such as measles or chickenpox once. Vaccination works by using this type of immunity. A vaccine contains a small amount of protein from a disease. This is not harmful, but it allows the immune system to recognize a disease if it meets it again. The immune response can then stop you getting the disease. Some vaccines use small amounts of the live bacteria or virus. These are live attenuated vaccines. It means that scientists have changed the virus or bacteria so that it stimulates the immune system to make antibodies. A live vaccine won't cause an infection. Other types of vaccine use killed bacteria or viruses or parts of proteins produced by bacteria or viruses. Now B cells and T cells. So lymphocytes are a type of white blood cells involved in the acquired immune response. There are two main types of lymphocytes, B cells and T cells. The bone marrow produces all blood cells including B and T lymphocytes. Like the other blood cells, they have to fully mature before they can help in the immune response. B cells mature in the bone marrow, but T cells mature in the thymus gland. Once they are fully mature, the B and T cells travel to the spleen and lymph nodes ready to fight infection. What B cells do? The B cells react against invading bacteria or viruses by making proteins called antibodies. The antibody made is different from each different type of germ or bug. The antibody locks onto the surface of invading bacteria or virus. The invader is then marked with the antibody so that the body knows it is dangerous and needs to be killed. Antibodies can also detect and kill damaged cells. The B cells are part of the memory of the immune system. The next time the same germ tries to invade, the B cells that make the right antibody are ready for it. They are able to make their antibody very quickly. How antibodies work? So antibodies have two ends. One end sticks to the proteins on the outside of the white blood cells. The other end sticks to the germ or damaged cells and helps to kill it. The end of the antibody that sticks to the white blood cell is always the same. The scientists call this the constant end. The end of the antibody that recognizes germs and damaged cell varies depending on the cell it needs to recognize. So it is called the variable end. Each B cell makes antibodies with a different variable end from other B cells. An antibody. Cancer cells are not normal cells, so some antibodies with variable ends recognize cancer cells and stick to them. What T cells do? There are different kinds of T cells called helper T cells and killer T cells. The helper T cells stimulate the B cells to make antibodies and help killer cells develop. Killer T cells kill the body's own cells that have been invaded by viruses or bacteria. This prevents the germ from reproducing in the cell and then infecting other cells. Cancer treatments that use the immune system. Some cancer treatments use elements of the immune system to help fight cancer. Immunotherapy. So immunotherapy is a treatment for some types of cancer, for example melanoma that has spread. It uses natural body substances or drugs made from natural body substances to treat cancer. They are helpful in cancer treatment because cancer cells are different from normal cells and the immune system can recognize and kill abnormal cells. Scientists can produce in the laboratory different chemicals that are part of the immune response. So they can make different types of immunotherapy such as monoclonal antibodies, MABs, which recognize and attack certain proteins on the surface of cancer cells, vaccines to help the immune system to recognize and attack cancer, cytokines to help to boost the immune system, and adoptive cell transfer to change the genes in a person's white blood cells. Okay guys, this was it for this episode. Thanks for watching and please subscribe to my channels. See you in the next episode.